The nonverbal communication in OSCE can be between the candidate and the mannequin, candidate and the simulated patient, candidate and the second RN who is present at the station. And the other nonverbal communication is your written documentation. Hi, let's learn together about communication in OSCE. In OSCE, the communication is nonverbal communication and verbal communication. This video is focusing on nonverbal communication. Nonverbal communication plays a major role in OSCE examination, and it determines how we interact with our patients. That means the mannequin or the simulated patient and the examiner. The nonverbal communication has three important areas. The first one is tone, second one is facial expression, and the third one is gestures. In nonverbal communication, you need to be mindful about your body language, controlled hand gestures, active listening, and facial expressions. In body language, what you have to do is you have to stand tall and with a good body posture. When you talk with your patient, smile minimally and nod where it is appropriate, and look into his or her eyes when you speak, and speak with an open arm. Avoid jittery movements when you speak, and don't cross your arms while speaking to the patient because it shows loss of interest. Active listening is an important part. For that, you need to mirror patients' emotions when you listen to them, and nod appropriately and maintain proper eye contact. Next point is appropriate use of hand gestures. For sure, if you are using the hand gestures properly, it will help you to emphasize the point which you are discussing. But if you are overusing the hand gestures, it will be very distracting to the patient. Appropriate facial expression is an integral part of nonverbal communication. When you are comforting your patient, you should be smiling. And when you are discussing a serious matter with your patient, you should be concerned for that situation. And when you reassure your patient, you should be empathetic towards that patient. And when you are discussing a serious matter, you should be attentive and listen actively to that patient. So depending upon the situation, your facial expression should be appropriate. And what are things you need to avoid in terms of nonverbal communication? Never roll your eyes away from your patient, or never sigh in front of your patient. Never look into your watch or clock while talking to the patient, and never show your hurry in your expressions. Don't exaggerate your facial expressions and hand movements. So these are the things you need to take into consideration while you give your OSCE exam. I believe considering these non-verbal communication techniques while you give your OSCE exam will definitely help you to success. Thank you so much for watching. See you in another video.